Welcome back to another episode of the Deals for Dentists podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. And my goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out my latest book, Stress-Free Dental Implants, and my first book, The Stress-Free Dentist, which both can be found on Amazon or thestressfreedentist.com. And check out my personal development retreat coming up in Chicago, May 18th to May 20th, called Roses and Thorns, or dentalgrowthcon.com. It'll be a no BS, intense but fun retreat where we dig into your top 5% and bottom 5% in your life and career. And we'll all learn from each other's strengths and weaknesses. And it's at the Eaglewood Resort and Spa. And attendees will get tremendous value and will hold each other accountable for your goals and intentions. And I hope to see you there, dentalgrowthcon.com. So enough about me. Let's get to my superstar guest here, Kandra Sellers. Thank you so much for joining us.
Absolutely. Thank you so much, Eric, for having me.
Now, Kandra Sellers is one of the predominant educators in the field of oral systemic health, intertwined with dental medical billing. She is the CEO of TIPS Medical Billing, which stands for Tandem In-Practice Solutions, and it helps ensure successful outcomes to billing the medical procedures that dentists do every day. Kandra, tell me all about your journey into dentistry and how you started TIPS.
Well, by trade, I'm a hygienist. I graduated in 1993 from hygiene school in Minnesota. I was fortunate enough to work for some really amazing dentists and specialties. So I've worked for prosthodontics, perio, cosmetic, general, you name it. I think the only specialty I haven't worked in is peds and oral surgery, which they don't, always need hygienists. And I can't imagine peds with children all day. That's got to be a tough one. Anyway, I started back then. I love dentistry. I really grew with it. I had a lot of great mentors along the way. One of those mentors came to me, back in 2015, when I started attending medical billing courses as a practice management coach at the time. And I went to his course 4 times. And I'm like, wow, this is such a great opportunity for the practices that we're coaching. I think I really want to learn more about it. So I went 4 times, immersed myself 2 days in those courses. I knew that there was an opportunity, but what I saw in the room was a lot of dentists and their admin person, or just their admin person attending the courses. And after 2 days of immersion, I would see blank stares, and I would just see like they were totally overwhelmed with all the information, because obviously medical billing is something completely different for dentistry. It's a whole different code set. It's we have to use diagnosis codes. It's not something that we use when we're practicing just dental billing. So I finally approached this speaker and I said, I know this is working. You're still speaking about it. You're showing success at these courses, but I see a real gap in our industry. And I'm hearing from so many of our practices that this doesn't work. And therein lies the myth that this doesn't work. It does work. And what I set out to do was try to create something different. There are third-party billers. There are, those opportunities. However, if you don't give the third-party billing company the stuff that they need, they're obviously not going to be able to get your claims paid. Sorry, my cat just jumped into the picture. The benefits of working at home. She wants to be on camera, apparently. And so I really set out to create something different. And that really is the one-on-one interaction with the practice to implement. from start to finish. There are so many nuances that go along with this because it is different and it's a learning curve. And it's just like any other technology or system that you bring into your practice. You typically have somebody helping you with that. As a doctor, if you have CEREC or you have laser, if you don't do the training that goes along with that, you're going to hate the technology or you're going to quit. And that was really my goal, is to get people successful and ensure their success. And that's what I've done. I feel like I have a different product than what most people have in the market because of the amount of interaction I have with the practice in the process.
Is that where you think you stand out from other dental and medical billing companies? Is that hand holding where you're really helping that office on a one-on-one basis?
Yeah, absolutely. Absolutely. And that's really what it takes, because if you don't, and again, like if you hire a third party to, maybe you'll know the codes and you hire a third party and they're submitting your claims for you. If you send them an operative note that doesn't meet medical necessity, you're not going to get paid. So there's only so much that you can do with a third party billing company. They're typically not going to coach you to the level that I coach you. So it's very different. It's a very different interaction. I mean, I'm on calls with my clients every single week, if not multiple times a week, depending on where they are in the process. So, my goal is their success, and I'm going to get them there.
It's interesting that you call yourself a medical billing coach, because it's like adding a new skill or a new language to the office. And that medical billing is a lot of times something so foreign to a dental office that you really need a coach to come in and help you. Is there a lot of myths and people that have tried and failed, and because that's what I've heard about medical billing is, oh, don't even bother because it's you're just wasting your time. Is that a big myth?
It's a huge myth. It does work, but again, and I get those clients all the time. I mean, I just started one 2 weeks ago, and actually a week and a half technically. And when I was there on Friday, he pulls out a book and it's from 2016 or something like that. And he's like, I've been going to courses since even before that time. And he's reached out to me in the past, but he finally decided to make a change and actually move it forward. And we literally have about $6,000 in pending payments for him. Out of that's 2 claims, $6,000 payments coming that are pending processing. And they've already told us that they're paying for it. So, think about how many claims you have to submit on the dental side in order to get to $6,000. And not only that, patients don't have that kind of money available to them on a dental benefit. Right? I mean,
Now,
this
this
is
client,
like $1,000 to $1,500. So
this client that you mentioned, was that considered retro billing?
yeah, so I know you and I chatted briefly about that. I typically start out with retro billing with a practice because it's a great opportunity for whoever is doing the billing in the practice to learn quickly. You've already been paid on it, but what about if you are in network with dental and that claim went to dental and you had to write off 30 or 40%? Let's go after that for medical. Let's close that gap of those write-offs that we have in dental. Because I've seen as much as 50% write-off on a dental claim. Let's go after that with medical, because I know patients have the benefits for many of the things that we do in a practice. So, yeah, I love to retro bill. I love to collect on services that have already been rendered and you've had a write-off. Or great marketing opportunity. A patient gets a reimbursement from you. When you can hand back a patient a bunch of money, are they going to be singing your praises? We work so hard. We work so hard to get new patients in our practice. And this opens up a whole nother door. How many people don't have dental benefits and they're brainwashed by dental, just like we are in some realms, that they can't come to you because they don't have dental benefits. And so they don't know how they're going to pay for your services. What if you could market that you could do an evaluation for patients so that they could at least have an evaluation, and then you just wow them when you get them into your practice, and you figure out an in-house plan for them or whatever it is that they need. But there are people dying. There are people dying from oral infection, and they end up going to an ER because they don't know where else to go. And they know the ER will take them and will take their medical insurance. But the ER is only going to refer them to a dentist because most ERs do not have a dental professional on staff. And that patient doesn't go to the dentist and they come back to the ER and they potentially have a stroke, heart attack, or they die. And I know that for a fact because I have a friend that's a transplant nurse, and she sees the end results of that. And she said, you cannot imagine how often that happens. So what if we could serve more patients, new patients? We could get new patients by marketing that we can see them if they have medical. What a great opportunity. We work so hard to get new patients, and this is just a no-brainer when it comes to medical, because the patients that you're billing for in your practice already are going to be singing your praises. And there's very few dentists that are doing this. So who's going to, if patient needs to have treatment, they're going to choose you over another provider in your area because you can bill medical. So
yeah, it's such a great way to stand out and to get new patients and referrals. And if you, like you mentioned, if you are reimbursing a patient, they're for sure going to recommend you to their friends and family.
yeah.
That's such a great point. Now, it sounds like from what you're saying that we can bill both dental and medical. Is that right?
That's correct. Yes, you can bill both medical and dental. And the caveat to that is you can't keep a penny more than what you billed. So, if there's an overage between what medical, dental paid, maybe even the patient, you can't keep anything over the billed amount. That would be double dipping. But it is not double dipping to access benefits from both medical and dental. The patient has benefits, they're paying for two different policies, and we can bill to both. We're one of the only specialties that can do that.
Mm-hmm.
Well, we are the only specialty that can do that. So why wouldn't we? It'd be no different than if you get in an auto accident and you're paying for auto insurance and medical. Everything's going to go through your auto insurance first, and then secondarily, it's going to go to medical. So it's no different. It's a great question.
Can we bill as a out-of-network provider?
Yes. You are going to be limited to PPO plans. Obviously, an HMO, you're not going to be able to tap into, or an EPO, which is very similar to an HMO. But the majority of patients have PPO plans. The majority of patients want to be able to go to any provider without restriction. That's what it comes down to. So you're going to see more patients having PPO plans. And there are statutes in place that if we submit an exam code, the insurance carrier cannot say we're not going to pay your provider type for that exam if they're willing to pay, say, an ENT for the same code. Now, I can tell you there are some states like Michigan in particular. One of their carriers is, I've tried everything. I've tried going to the state insurance commissioner. I've tried going to the federal government to call them out on the statute that states that they can't discriminate against our provider type. However, the state of Michigan and the dentists there need to do that, not just me as a solo person. They need to stand up to that carrier because they are doing a huge disservice to the patients in that state. Patients are paying thousands and thousands of dollars out of their pocket for services that they have benefits for. So anyway, long story short, yes, we can bill as an out-of-network provider. When people hear that, they get really worried about deductibles. So I'm going to talk briefly about that. Deductibles are deductibles. it doesn't mean that every code will go towards deductible. I often see surgery not touch deductible at all. I have a $75,000 case that, and it was, and part of that was done January 1st of whatever year it was. And then the other part was done, the mandible was done like 6 months later. $75,000, about $200 went towards deductible of that entire case. So it really is going to be dependent on the quality of the patient's policy. They will always, the insurance carrier, when you verify benefits, will always tell you, after deductible is met, this is how we pay on these particular procedure codes. But, and you can always start with, here's your deductible, as far as, what the patient is going to have to pay out of pocket. But I can tell you so many cases where it does not apply to the patient's deductible at all. So deductible is just a term. It doesn't mean that based on the code, it will apply to deductible. Mm-hmm. So don't get worried about these higher out of deductible network, these higher out of network deductibles. That's not really for starters, we can't worry about or control the type of insurance the patient has, right? I mean, they may be dictated by their employer, or if they're self-employed, obviously, maybe they're trying to keep their premiums lower. We can't control that. All we can do is bill for them. And, quite honestly, even if it goes towards deductible, that was a claim that processed and the patient got a benefit. So, it's no different than if they went to a medical provider and had a procedure done. If it goes towards deductible, it goes towards deductible. We did our part. They got a benefit. Now, unfortunately, it might have to come out of their pocket to pay, but that shouldn't change how we do our financials or anything like that. Our financials are financials, and we can't just sit and wait for medical to pay, because one of the biggest things as an out-of-network provider is you're not going to have a fee schedule, so you're not going to know what they're going to pay. I have lots of data that shows about what they will pay, but we can't put ourselves into being the bank for our practice and for our patients. We need to continue our normal financials. And if that is patient has to pay up front, then the patient pays up front and we reimburse them when we get reimbursed by the insurance carrier. So
now you mentioned that, some things are just not in our control, and to not get too caught up into that. But what is in our control is documentation.
Mm-hmm.
How important is, the quality of our documentation, our notes, the medical necessity? How important is that in medical dental billing?
It's critical. It's critical. And it's one of the hardest things I have doctors get on board with, but it's super important. If your notes are not meeting medical necessity, whether we submit a medical claim and they ask for the supporting documents and we send it, if they're not meeting medical necessity, they are not going to pay you. Now, even if you are submitting to dental and you get audited, if your notes are not meeting medical necessity as to why you did the service you did, they're going to ask you to pay a chunk of money back. So that's one thing that I help practices with, is enhancing their notes to ensure that we're meeting medical necessity. My niche has really been a lot of surgical stuff. And, I really try to customize the notes so it's not such a big change for your practice. Insurance carriers don't like templated notes, but I try to take what you have and enhance it to ensure that it's going to pass medical, as far as, them saying, yes, we're going to pay you for this claim. This makes sense to us. And we can see the need. We can see that it was medically necessary. So that's something that I pride myself on, is the customization for every practice, so that, it is a different process. And the last thing I want is for you all to be stressed out about the process. I want you to be excited about it. And so, coming in and trying to change everything that you're doing is not easy. I want the notes to still feel comfortable to you. So I just really try to enhance them to make them better.
You mentioned surgery. What are some common procedures that we can bill to medical, sleep apnea, extractions, bone grafting, all the above? What are some other procedures?
Yeah. So sleep apnea for sure. TMJ Botox, seeing some great things happening with Botox. You've got frenectomies, you've got implants, grafting, your membranes with grafting, alveoloplasty. And by the way, with all of those things, with all of that type of treatment, comes a diagnostic phase, right?
Mhm.
We have to diagnose, we have to do evaluations, we have to take x-rays. All of those things to diagnose the condition are also paid by medical. So your CTs, your lateral cephs, your PANs, your evaluations can all be paid by medical, which is a huge game changer. You know, when I look at evaluations and I see dentists being reimbursed $30 for an eval, it makes my stomach turn. My MD, when I was in, he was like, you know, you're asking so many questions, because I do. Being in the field, I have a lot of questions always. He's like, I'm going to have to increase the level of your evaluation because we're talking about a lot of different things. I'm like, okay, that's fine, whatever. I want my questions answered. And he's like, well, I just am telling you because, you know, it's just sick what they're reimbursing me, you know, for these annual evals. And I think he even gave me a number. And I said, I don't even want to hear it. I said, do you understand dentists are reimbursed about $30 on average for an evaluation? And he just shut up. He's like, he would never work for $30 for an evaluation, right? It's just crazy. And I've even seen fee schedules where they'll have a dental code, like say D120, and a medical code, and medical is very different in how they do evaluations. They're based on complexity. They're based on time, which makes a lot more sense because say an 01210, is that different for a patient that's 10-year-olds versus a patient that's 70? Absolutely, in every way, shape, and form. But we're reimbursed this much and that's it. It's truly a benefit plan. It's not an insurance policy based on any logic, really, in my opinion. So, you know, you think about evaluations, and like I said, I've seen an 0120 and a eval for medical, that code, the CPT code, right next to it, that is double or triple for the same type of process that we're going through in a hygiene area, or an eval for somebody that comes in as an emergency. It's crazy the difference in reimbursement on the medical side compared to dental. It's night and day.
Is medical decreasing like dental is? You know, it's such a hot topic right now of dental reimbursements going down. Is medical, do you see that happening as well?
No.
No.
And in fact, I mean, you know, the reality is our dental fee schedules are a joke, because you might have a fee attached to every procedure that's in the CDT codes. But the reality is they don't always pay on that code. So it's like, well, then why do you put it on my fee schedule if you're never going to pay it, right? So that's the other thing. And the reimbursement is so different. I mean, like grafting as an example. Grafting, we're doing a ton of grafting in dental practices now. And the highest I've been paid for a client on grafting was $9,500 per quadrant. And that was a pre-negotiated fee with the insurance carrier. I was so mad because I could have charged higher. I could have given them a higher number, you know? And when you look at total case fee, you can submit total case fees. Like we're very structured in dentistry that this is all we can charge, and that's it. We're doing that because we have a dental fee schedule that tells us that's all they're going to pay.
Mm-hmm.
Medicine is not like that. A surgery, one site of grafting versus a quadrant of grafting is very different. The amount of material that you're utilizing is totally different in that situation. So you can have sliding scales based on the complexity of the encounter. On average, I see even my in-network providers for maxillary getting on their fee schedule, probably around $4,000 per site of grafting. Mm-hmm. And on the mandible, it's more like 5,000 or 6,000 per site. Now, obviously you have to be willing to charge that out. But isn't that a game changer? Most practices that are grafting, they're probably not even recouping their material fee, let alone all the education and training that you've had to be able to do these procedures. You're not even close to getting reimbursed as a medical specialty. So that's what there's nothing more exciting to see dentists getting paid as a medical specialty.
Now, Kandra, a lot of these procedures you mentioned we're already doing. How far back can you retro bill for procedures that we've already been doing? Is it like up to a year?
Most carriers allow you up to a year. Yeah. Mm-hmm. They're all a little different, but most of them are up to a year. Some of them are 6 months. Some of them are only 3, very rarely. Most of Blue Crosses are a year. Typically if I'm working with a client, I say we start medical billing today, and I'm like, start collecting medical cards ASAP on every single patient. Patient comes in, if there's something that we can bill, I'm going to be looking back at their ledger and seeing if there's anything else we can bill, so that I'm training that person who's doing the medical billing on lots of different things and recouping whatever we can that we had to write off in for that particular patient. So up to a year often.
Yeah. So this is a whole new way of looking and coaching, and this is game changing stuff. So Kandra Sellers, how do we find out more? What's the best way to get in touch with you?
So the best way would be to go to my website, tipsmedicalbilling.com, TIPS medicalbilling.com, and just go to my contact page. It'll ask you a few questions about yourself, so I know where you are geographically, and give me some ideas of the things that you're doing. You can make a note of anything that you're interested in or what you want to talk about. And then from that point, I'll reach out to you and schedule an opportunity assessment called a MBA, which is a medical billing analysis, where we can talk and discuss, the opportunities I see for your practice with the procedures you're already doing. And that's really about it. That's the best way to really get a good handle on, is this the right fit for me? And also, am I the right fit, or is TIPS the right fit for you? That's always, there's not don't have too many issues getting along with people, but it's important for you to feel 100% sure that you can trust me in this process. Because again, there has been so many things out there. I've seen so many fraudulent things happening in the industry, and I find those all the time. And it's important for us to be on the same page, and for us to be able to communicate well, so that we can elevate your practice and help your patients get reimbursement for the things that they're paying out of pocket for right now.
So Kandra, I just had one final question, because you're a hygienist, you're an entrepreneur. What's some advice that you would give to a young dental professional or a young entrepreneur out there?
Oh, that's a good one. Never give up. I think every role that we can play in this industry has challenges, but you have to be willing to fight through those. Especially with medical billing. I mean, you're fighting with insurance carriers to fight through it, and that can be daunting. But I look at that as an opportunity. It's an opportunity to learn. It's an opportunity to grow professionally and personally. Be willing to ask. Be willing to ask for support and help. I come from a strong coaching background and have done a lot of training on coaching, and you shouldn't have to ever go it alone. Surround yourself with the people that are like-minded, that want to grow and be an entrepreneur like you, and continue to excel, but don't ever give up. That's I don't think anybody likes to fail. Failure is scary, and being an entrepreneur, fear can paralyze you. I have my own business coach. That's important to me, because I do allow fear to paralyze me sometimes, and I need somebody who's going to push me through. And that's what I do with my practices. We're going to push through this. We're going to have challenges. It's okay. Know that you've got somebody on your side that can help you through the process.
That's great stuff. Kandra Sellers, thank you so much for joining us.
Absolutely. Thank you, Dr. Block, for having me. I'm really excited to be working with you all.